For 30 years, hantavirus was considered a disease with one rule. You get it from rodents. It stays with rodents. It does not pass between people. In May 2026, that rule was broken. A cruise ship departed Argentina in April. By the time it reached European waters, passengers from 11 different countries had tested positive for a strain of hantavirus, the Andes virus, with confirmed human-to-human transmission. 3 people died. The World Health Organization classified the outbreak across multiple countries simultaneously. This is not a disease that stayed in the wilderness. And if you are over 60, what the science now tells us about this virus, and about how your body responds to it, is something you need to understand clearly, calmly, and completely. That is exactly what this video is going to give you. If this is the kind of evidence-based health content you want more of, subscribe now and hit the bell so you never miss an update. And type the word "informed" in the comments. It helps us understand who needs this information most. Hantaviruses are a family of more than 50 viruses carried silently by rodents, primarily mice, rats, and voles. The animals themselves remain healthy. The virus persists in their urine, droppings, and saliva. Human infection occurs almost entirely through inhalation. When dried rodent waste is disturbed, during cleaning, renovation, or simply moving through an enclosed space, microscopic particles become airborne. A person breathes them in. The virus enters the body through the lungs. In the Americas, the result is a condition called Hantavirus pulmonary syndrome, HPS. The virus triggers an immune response that causes the tiny blood vessels in the lungs to leak fluid. As that fluid accumulates, breathing becomes progressively harder. In severe cases, the lungs fail entirely, a condition known as acute respiratory distress syndrome, or ARDS. The historical case fatality rate for HPS in the Americas has ranged between 35% and 50%. The 2026 Andes virus outbreak carries a confirmed fatality rate of 27%, lower than the historical average, likely reflecting advances in intensive care. But it remains one of the highest fatality rates of any virus currently active anywhere in the world. There is no approved antiviral drug for hantavirus. Treatment is entirely supportive: oxygen, ventilation when necessary, careful fluid management. The earlier a patient receives that care, the better the outcome. That single fact drives everything else in this video. Until 2026, the Andes virus, found primarily in Argentina and Chile, was the only hantavirus strain ever documented to spread between humans. Even then, that transmission was considered rare, requiring prolonged and close contact. The MV Hantavirus outbreak has provided the clearest real-world evidence yet of how that transmission can occur at scale. The ship carried 147 people from 23 countries. Genetic sequencing of the virus isolated from multiple patients showed near-identical sequences, confirming a chain of human-to-human transmission rather than independent rodent exposures. The WHO's working hypothesis is that the initial infection occurred on land, likely during the ship's departure stop in Argentina, and that human-to-human spread then occurred on board, facilitated by the close quarters, shared ventilation systems, and sustained proximity of cruise ship travel. It is critical to understand what this does and does not mean. The Andes virus does not spread through casual contact. It does not travel freely through outdoor air. Transmission has been documented in settings of close, sustained exposure, shared sleeping quarters, direct physical contact with a symptomatic person, or prolonged time in a poorly ventilated enclosed space with someone who is actively ill. All other hantavirus strains remain rodent to human only. The Andes virus is the exception, and it requires specific conditions to pass between people. There is no published data yet specifically examining age as a risk factor in the 2026 Andes virus outbreak. What we do have is a well-established body of research on how the aging respiratory and immune systems respond to severe viral infections, and that research is directly relevant here. First, lung function. After the age of 65, lung elasticity declines, airway clearance slows, and the functional reserve, the body's ability to compensate when the lungs come under stress, is reduced. When HPS causes fluid to accumulate in the lungs, an older body has fewer physiological reserves to manage that process. Second, immune response. Aging alters the regulation of inflammation. The initial immune response to a new pathogen may be slower to mobilize, but the subsequent inflammatory cascade, the immune system's intense reaction, can be harder to regulate. In HPS, it is primarily this immune overreaction, not the virus directly, that causes the most severe lung damage. Third, comorbidities. Cardiovascular disease, type 2 diabetes, chronic kidney disease, and COPD, all of which are more prevalent after 60, reduce the body's capacity to tolerate the cardiovascular stress that severe HPS creates. None of this means older adults cannot recover. It means that speed of recognition and speed of treatment are proportionally more important with age. Hantavirus pulmonary syndrome progresses in two distinct phases. Understanding both, and the gap between them, is the most important medical knowledge in this video. Phase 1. The early symptomatic phase. After exposure, the incubation period ranges from 4 to 42 days, with an average of approximately 14 days. When symptoms begin, they are nonspecific and closely resemble influenza. Fever, fatigue, and muscle aches, particularly in the large muscle groups of the thighs, hips, back, and shoulders. Headache is common. Nausea, vomiting, and gastrointestinal symptoms may also appear. This phase typically lasts 3 to 5 days. During this window, most people assume they are dealing with a standard viral illness, and in most cases, they would be correct. Flu remains far more common than hantavirus, but the exposure context changes the calculation entirely. Phase 2, the cardiopulmonary phase. Approximately 4 to 10 days after the first symptoms appear, a proportion of patients, particularly those with more severe infections, experience a rapid deterioration. Shortness of breath develops. The chest tightens. The ability to take a full breath diminishes. This is the point at which fluid is actively leaking into the lungs, and it can progress to respiratory failure within 24 to 48 hours. This is the critical window. A patient who reaches hospital care before phase 2 is in a substantially stronger position than one who waits until breathing is severely compromised. The symptom that distinguishes hantavirus from standard flu, and the one that demands immediate medical attention, is shortness of breath appearing after what seemed like a routine viral illness. That combination, in the right exposure context, requires urgent assessment. If you want to be notified the moment we update this video with new outbreak data, subscribe now. We'll be posting updates as the WHO releases new information. This disease, while serious, is statistically rare. The CDC has recorded fewer than 850 confirmed cases of hantavirus pulmonary syndrome in the United States since surveillance began in 1993. And it is largely preventable through consistent, well-established practices. Here are the 3 areas that matter most. Prevention Area 1. Safe cleaning in enclosed spaces. The highest risk activity for hantavirus exposure is disturbing dried rodent waste in a poorly ventilated enclosed space. A garden shed, a garage, a holiday cabin, a basement, or an attic. For seniors who may be returning to seasonal properties or beginning spring cleaning, this is the most relevant risk factor. The protocol, as established by the CDC, is precise. Before entering a closed structure where rodent activity is suspected, open all doors and windows and allow fresh air to circulate for at least 30 minutes. Do not enter immediately. Never sweep or vacuum rodent droppings. Dry disturbance of waste, even with a brush, sends infectious particles directly into the breathing zone. Instead, prepare a disinfectant solution. 1 part household bleach to 9 parts water. Spray the affected area thoroughly and allow it to soak for 5 minutes. Then, wearing rubber gloves, wipe the waste up with disposable paper towels. Seal the towels in a plastic bag before disposal. Wear a well-fitted mask if available, at minimum an N95 respirator for any significant cleaning task in a rodent-affected space. Prevention Area 2. reducing rodent access at home. Mice can enter a structure through any gap larger than approximately 6 millimeters, roughly the diameter of a pencil. Seal gaps in exterior walls, around pipes, and under doors with steel wool, caulk, or hardware cloth. Store food, including pet food, in sealed, hard-sided containers. Remove potential nesting materials, cardboard, fabric scraps, insulation stored loosely. A reduced rodent presence is the most upstream prevention available. Prevention Area 3. Knowing when to seek care. If fever, muscle aches, and fatigue develop within 6 weeks of any potential rodent exposure, or any contact with a person recently diagnosed with Andes virus, seek medical assessment promptly. When speaking to a healthcare provider, state the exposure context explicitly. Hantavirus is not a condition most clinicians consider automatically in the early symptomatic phase. The exposure history you provide is the information that triggers the right diagnostic response. As of May 2026, both the World Health Organization and the United States Centers for Disease Control and Prevention assess the risk to the general public as low. The Andes virus does not spread through community transmission. It is not airborne in open or outdoor environments. Contact tracing for all passengers and close contacts of the MV Hantavirus has been initiated across 12 countries, and affected individuals are quarantined and monitored. The population with elevated risk at this time is narrow and specific. People who were aboard MV Hantavirus between April 1st and mid-May 2026, or who had close sustained contact with a confirmed case. If you fall into that category, contact your healthcare provider immediately and reference the MV Hantavirus Andes virus outbreak. For everyone else, the relevant risk remains what it has always been: exposure to infected rodent waste in enclosed spaces. That risk is real, manageable, and the prevention steps in this video address it directly. Hantavirus is serious. The 2026 outbreak is real, and the science on this virus has shifted in ways that matter. But the steps that protect against it are not complicated. Ventilate before you clean. Never disturb dry rodent waste. Seal the entry points. And if symptoms develop after a relevant exposure, seek care early and tell your doctor exactly what you may have encountered. Knowledge is not the same as fear. It is the opposite of it. If this gave you something useful, type "ready" in the comments and share this with someone who needs it. We will be updating this video as the outbreak develops. Subscribe and hit the bell so you are first to know.